So now, going to the perio mode. So again, with the color coding, and I alluded to this in the beginning, with discovering deposits, if you see, over here where my cursor is, you have orange or yellow, that would tell us that that's calculus. And a grainy and a white patch, like we see right here at the cervical, that's plaque. And the gingival inflammation will show up magenta. And pink is actually, healthy gum tissue. So let's go into this. Now, it sure beats, and anyway, I guess I'm dating myself, but when I went to hygiene school, the only way we could instruct the patients on where the plaque deposits were was by using the red coat disclosing tablets or the dye. And nobody likes this. If you're a hygienist, you don't like to use it. If you're a patient, you don't like to have it used on you. So no need for that anymore. So it kind of just throws that right out the window now, because we can actually educate our patients just by using this technology. Let me just show you some examples. Here's, the lingual of number 27. Now, I will tell you from experience, as much as any of us dental professionals look at this film, we can all say, I see the calculus right there. Yep, I see it. No problem. To patients, it's not that easy. So when I have this technology, I can actually highlight, and they will see all the calculus and the gingival inflammation much easier. So again, what is commonplace to us, I can't tell you how many times I have this beautiful large image, and I'm showing the patient, and they're like, well, it's white, just like my tooth. I'm like, well, it's a different color white, And you can tell they're trying to be respectful, but they don't see what we see. And some of them can, they'll pick up on it, but the more obvious it is, and this one right here, I don't think is very obvious. It's very subtle, but it's much more obvious when you use the technology. Now we'll look at the facial of number 10. So all of us here, everything's jumping out of us, the inflammation, the swelling, you can see the plaque, you see calculus on the facials, you see pitting. Well, we're all dental professionals, so it's very obvious to us. But when a patient sees it like that, we can tell them, look how much inflammation is here when you see the pink and the magenta and the little pieces of calculus that are embedded into the little defects in the enamel there. So it's very powerful for patient communication.